That's good. We're going to move on to Gabie next. So again, starting with Gabie, we're a bit aware from the past with her eye specifically that she does have a deposit on her cornea, which is the clear protective layer itself. And I'm just going to see if it's any different than it was. And no, it's faint, but it is very visible. Hey, stop getting. It's faint but visible right in the center there. And like actually Coco, she's also developing cataract. I don't remember that from before. At the I can see something down about the 8 o'clock position in her left eye. I'm just going to check her right. Again, it would be polar, so it means it's on the outside. Nothing in this eye though. Interesting. Yeah, again, this is why we check. You can see the gums all healed up beautifully from extraction. And I'm just checking the rest of them now. No, there's certainly not that pain and discomfort that we were seeing before.
She tried to eat a metal cage,
So what I will mention though, is it's not from tartar, but you can see there's quite a bit of gingivitis. It's extending quite high up there.
You know, doctor, she stole big bone from another dog and she chewed it until her gums started bleeding. It happened 2 days ago.
So that could be the reason, especially because it is equal on both sides there. So in these cases where there's a possible trigger, I say, I'd like you to look at them in about a week or so, once that bone's been taken away.
Okay.
If it's still there, that might be a sign of something going on.
We keep it away now.
Perfect. Good. And same thing, I'm gonna check her ears. Gabie, head up. Good girl. Excellent. Beautiful ears. A little bit of discharge on this side, just a little bit, nothing to be too worried about. You can just see a little bit, that brown discharge there.
It just walks, probably.
I'm not too worried about at this point in time, unless she's really bothering with it. Good. She's leaning a little bit to that side. I'm just going to put a swab in her ear. I don't want to swab out every patient's ears because they don't love it, but just whenever they kind of lean in there, just making sure that there's not signs of infection deeper in. Dog's ears are not like human ears. They're shaped like 90-degree angles, so I can actually go right deep with this. I'm not going to do any damage, come anywhere near that eardrum there. No. And again, that's a more normal swab. I'm just going to do the other ones since I have a swab anyway. But if this was infected, it would have a smell to it. Also, this would come out a lot more coated, which is just not right now. So I'm not too concerned.
Okay. Thank you.
Good. Having a feel around her neck. Same thing. Feeling for the saliva glands, the lymph nodes. Very important in golden retrievers, especially as they get older, to feel for lymph nodes because that is a very common place for them to start developing lumps, bumps, and masses. So I don't feel
like lymphosarcoma or something.
That's exactly what I'm concerned about. Which, amazingly, and we were talking about this, although it's not a test I think we need to do with Gabie right now, we now have first of its kind a blood screening test for lymphoma long before we are seeing the obvious signs of it. So it's something that I don't think we need to do with her. If ever one of her lymph nodes did become big, I would absolutely recommend it. Just so you know, it's not a big deal. She does have a burr on this one side here, so that can be combed out at home. I don't need to do anything with that myself. Good.
And she was paralyzed 2 years ago. Now she's running like baby, like puppy.
She had a special type of paralysis where one of her discs temporarily slipped out of place in her back and then slipped back into place. It's amazing because she did not need surgery, but it's also the rarest type of slip disc as well. So Gabie was very lucky in that point because... But
I followed the neurologist instructions very close. I did massage, I did exercises, what he said us to do.
And
so
the results are in there as well.
We walked it,
she did.
We warmed this area before exercises and did extension exercises.
Everything's feeling good in her belly too. Good. All right.
But she's scavenging for food. She's scavenger.
And that reflects in her weight as well. So it's definitely something that we want to address. I'm just going to consult my notes and see exactly what they are both due for. And then we will ask to make sure that those are the vaccines we still need to be given. And we'll take it from there. Just let me boot up my machine and we'll take it from there. Okay, guys?
Probably 2 vaccines out of date.
Very important part of this as well. We always ask first, do they have any allergies to beef?
No.
Excellent. So they may have beef treats. One of the
Thank
things,
you.
you mentioned this to me before we started our exam, that Coco may be having some trouble hearing. So I'm going to do, unfortunately there's no blood test for that, but I'm going to do some simple hearing tests that are crude, but they are effective.
Mm-hmm.
Good. Do you see how he properly turned his head that way? That's a good response to sound. Good. Good. Very crude test, but they assess for high and lower frequencies. As far as I can tell, he's hearing okay, which means that it may be more selective hearing. Now, could he be losing some of the frequencies of his hearing? Absolutely. It's always a possibility that that's exactly what we're dealing with, that he can hear this frequency, but kind of our speaking frequency, he's not hearing as well. That can happen. Yes, deafness happens to dogs too. I'm just not seeing the obvious. I can't detect it on my exam, so I'll just have you to continue to monitor it from there.
Okay. Thank you, doctor.
You're very welcome. And tell me about anything else that's going on with them.
No.
Good. In which case,
We try to keep them active and give some food toppings. They're on Royal Canin most of time. This is major diet for them, and we give some toppings every day, like salmon oil, blueberry, and pumpkin.
good. I have no problem with any of those. So again, everything in moderation, especially because Gabby seems to be overindulging.
Of course.
So we'll definitely make sure that we pay.
Also, I add, I give them only natural treats. I am doing by myself, so it's no cinnamon in it or something else like this. Only natural treats.
Good. And again, everything in moderation. So
Everything in moderation. I don't give too much protein. I give them some raw meat, rich, like hard meat.
So
It's just 2 pieces a day, 2 small pieces a day.
Always love to broach into that subject. It's something we've talked about before as well. So I often will get asked my opinion on raw meat in dogs. And the honest answer is, I worry more about the humans giving the meat because we have compared to them, we have a very wimpy digestive tract. So for people who have young children in the house, people on immunosuppressive drugs or immunocompromised people, it's something that I prefer not to. The same thing applies to dogs as well. They have issues with their immune system, that sort of thing.
I absolutely agree, yeah.
So it's just something that we have to watch. It has to be something that should be really discussed with your veterinarian and even with your own family doctor as well, because they may have reservations about exposure to raw meat and things like that. So yeah, good question though.